It's actually considered the most common complication following delivery.
According to Postpartum Support International, 1 in 7 new moms experience a prenatal mood and anxiety disorder, which is commonly known to most people as postpartum depression, and it occurs for a variety of reasons.
One of the most common reasons is hormonal shifts. Estrogen and progesterone levels greatly decline and change rapidly after having a baby, and that can certainly affect mood. Also, sleep deprivation. Certainly after having a baby, you're not going to be sleeping a whole lot. That affects mood as well. There's the stressors of having a newborn and caring for them. And then other risk factors include a history of depression or anxiety, poor relationship stress, or a poor support system makes a difference as well.
And there are some telling symptoms you can look out for.
It can present in a variety of ways. If it's more the depressive side of things, it tends to present with feelings of guilt, being down, crying frequently, either sleeping too much or not enough, overeating or not eating enough, versus it can also present with severe anxiety, feelings of extreme irritability or anger, feelings of being overwhelmed. And then one symptom, if you should always let your provider know right away about is any feelings of self-harm or harming of others. You should let them know right away. A really common risk of postpartum depression is breastfeeding issues as well.
In these cases, it's important to reach out to your primary care doctor or women's health provider as soon as possible to figure out your options, including the several support groups Spectrum Health offers.
On Tuesday nights, they actually have virtual meetings that women can go to with their babies to talk about postpartum depression. Pine Rest is a great women and infant support group that's great as well.
However, keep in mind there could be a stage you just need to give yourself some grace.
The baby blues are even more common. They occur in over 50% of women and tend to occur within the first 2 days to first 2 weeks of having a baby. If it's lasting longer than 2 weeks, typically it's not the baby blues anymore. But even if it's before 2 weeks, if your symptoms are severe enough, you should get help right away.
And if someone in your life is struggling, there are ways you can help.
A lot of times postpartum depression sufferers are the last people to know they're suffering with it. They're just kind of living their life day to day. And it's people around them who notice the irritability and crying. And so let them know that you care and that that's happening. And also offer support. Certainly something as simple as just holding baby for a couple hours so mom can get some sleep, or doing simple chores or cleaning around the house makes a big difference and helps a lot.
In Grand Rapids, Alyssa Heron, Fox 17 News.